My name is Dr. Trent Jones, and I want to begin also by thanking all of you for being here. I can't tell you how much I appreciate you taking the time to come and express your opinions. And not that you have any reason to, but if you want to yell at me, that's okay. I'm not going to shut you down. I actually want to hear from you, and I want to hear what you have to say. But I should begin by telling you that I am a practicing physician and surgeon of 10 years. After having graduated from the University of Utah Medical School, I practice in Utah County. I don't consider myself a Democrat or a Republican, but a fiscal conservative. I'm going to say things to you today that are probably a little bit irreverent and politically incorrect, but I think it's time that we get a little bit of political incorrectness in our public dialogue. Okay? So whatever your political persuasions are, Republican, Democrat, Independent, Libertarian, or whatever, I feel that your opinion is important, and I would like to hear it tonight. I didn't take a bus here today. Nobody paid me to come speak. I'm not representing any particular group. I don't have an agenda to push. I just have a feeling in my gut that we need to do something about what's happening in our country, and that's what I'm here to share with you tonight. Homeland Security doofus Janet Napolitano branded me a right-wing extremist. I guess that's because I teach Sunday school once in a while. I go to church. I enjoy spending time with my wife and my kids. I read, and I enjoy and I appreciate and value the Constitution. And I have a feeling that those are qualities that we share in common. Princess Pelosi, before she got on her Gulfstream jet and went home on her weekly commute, said that you were all members of an angry mob. Well, I'm going to claim membership in that angry mob. I'm an angry mobster myself. So this is what I have to say. We are facing a crisis of epic proportions, but I believe it's a crisis of our own making. Some of us voted in the last election. Some of us, unfortunately, did not. Some of us may have voted for Nancy Pelosi. Some of us probably did not. Some may have voted for Harry Reid. Some voted for Bob Bennett. Some may have even voted for Barack Obama. Unfortunately, some of us did not, still. But regardless of whom we may have voted for, we have all created this crisis. It's a crisis of credibility, a crisis of reliability, and a crisis of affordability. Our officials in Washington, be they elected or non-elected, congressmen and czars, are hell-bent on transforming our culture, our values, our traditions, and our beliefs. While Hollywood transforms our morals, the mainstream media distorts our understanding of history and current events. And Barack Obama attempts to remake America. I don't know about you, but personally, I like the America that Washington and Franklin and Jefferson created. Our healthcare system is broken. At least that's what we are told over and over again. We are facing a crisis, but it's not the crisis our community organizer-in-chief would have us believe. Obama says if Congress does not pass an unread, unexamined, 1,100-page transformation of 20% of our entire economy, a bill that they have euphemistically called the Affordability and Health Choices Act, then our economy is really going to be in trouble. Well, after talking down the economy for 18 months, Barack Obama was elected on a promise of spreading your wealth around. The stock market saw its largest election day decline in American history. And as a personal student, a junkie of politics and economics, and watching way too much news on TV, I can tell you from my own experience that the closer that Barack Obama got to election, the more our stock market tanked. It was a day-by-day, tick-for-tick change. I followed the poll results, and every time he went up in the polls, the stock market dipped a little. And every time he went down, it went up a little. If you watched the results even on election day, when there was a chance that liberal light McCain was going to be elected, according to those Eastern polls, the stock market saw a bump up. Jim Cramer, committed Democrat, but probably no friend to the liberals on his own television station, had a thing on his show just 2 nights ago where he actually put a graph up that showed as Obama's unfavorability rating goes up, the stock market goes up too. Barack Obama is a problem, and our political leaders who are following his lead in Washington are a problem, and that is what is damaging our economy right now, because people who are understanding and economically literate know what their agenda will do to American business and jobs and prosperity. If Obama's election bite to our personal welfare was not enough, he then set about destroying our prosperity like no one since Franklin Delano Roosevelt, when he deepened and prolonged the Great Depression by spending too much and wasting too much. Roosevelt began the great Ponzi scheme of Social Security. Lyndon Johnson took his cue and began Ponzi Medicare. Bernie Madoff has just been sent to prison for 150 years for his Ponzi scheme. But at least his investors had a choice. You're not going to have a choice. These crooks, these betrayers of the public trust, will forcibly part you from your livelihood, your industry, your thrift, and they will never face a jury. Jimmy Carter begat the Community Reinvestment Act, which then begat ACORN, which then begat Barack Obama, who has now quadrupled our federal budget, our federal deficit, and has spent more money in his 6-month presidential infancy than every president from George Washington to George W. Bush. Pass the stimulus bill now, Obama said in the dead of night, so that unemployment won't rise above 8%, and now it's climbing over 10. Fed Reserve Chief Ben Bernanke said in testimony to Congress recently that he does not expect any new net job creation for 5 more years. I'd like to know, is this the hope and change that we voted for? Your taxes will not go up, not one thin dime, Obama said. And then the first thing he did in office was to pass a regressive tax on cigarettes, which disproportionately affects the poor and the lower class. He is just aching to pass the cap and tax legislation, which will raise taxes on energy, on the food you eat, and the very air that you breathe. This has been described as the largest tax increase in American history. Our government has taken over the banks, the auto industry, the insurance companies, the housing industry, and now they're coming for your health care. Our health care is broken, they say, and what they really mean is that Medicare and Medicaid, which are systems of their own creation, are breaking us. I've spent a lot of time in my career caring for veterans in the VA hospital as a medical student and as a resident. I know what that government system is like. Those dear men in that system are some of the finest souls that I've met. Excuse me. They are true American heroes. But the rationing of care that I observed, the waiting for care that they experience is heartbreaking. Because time matters, and care delayed is care denied. Whether it's the rotting mold in the Walter Reed Hospital, the interminable and insufferable bureaucracy of the VA, or the impending insolvency of Medicare, where and when has the government ever shown its aptitude for providing health care? I'd like to know. Politicians use Medicare and Medicaid as an example of health care delivered. Both of those systems are going bankrupt. They're going out of money. They have $52 trillion of unfunded liabilities. They cannot be further sustained unless dramatic changes are made to that system. That's the crisis that we really are up against. It's not the health care that you may have, your private health insurance, that 89% of Americans appreciate and think is fantastic. That's not the crisis. The crisis is the programs that the government have already inflicted on us. And as has already been mentioned today, unless we make a move to restore our system to free market economics, there is going to be a significant crisis, and elderly care in this country will come to an end. We have the finest healthcare system in the world. Refugees from healthcare systems of Canada and Cuba, Mexico, and socialist Europe travel here to receive treatment because of our quick and easy access, our high quality and excellent outcomes. Ours is a nation of innovation, a leader in pharmaceutical intervention and interventional advancement, but the government is making it increasingly difficult for me to care for my patients with increasingly arcane levels of bureaucratic interference and decreasing levels of reimbursement. Let me share with you a personal anecdote of how I have experienced the Medicare system. Recently, 6 months ago, I received a letter from Novidian, which is the healthcare, or the Medicare clearinghouse. And it was a letter explaining the payment and the benefits for 6 different patients that I had performed surgery on. It listed the amounts that we had billed and the amounts that I had been reimbursed. The total amount for those 6 patients that I performed surgery on, 0. Why was it 0? The explanation at the bottom of the explanation said that it was because the font size that we had used to send in our bill was too small. How could that be? My girls do this all the time. They've been with me for a decade. So I brought the letter to them and said, why is this returned unpaid? And they said, well, the font size was too small, I guess. I said, well, what font size did you use? 12 point. I said, what size are you supposed to use, according to the HCFA rules? 12 to 14, either one. I said, well, okay, why didn't you use 14 then? They said, because when we submit this bill in 14 point, our laser printer touches the line that it's billed on, and so they return it unpaid. We've submitted these bills 6 times over 2 years, and I never got paid a dime. And at the bottom of this letter, it said, and oh, by the way, since you've taken so long to bill this claim, there's no reimbursement. You've taken too long. There's no appeal to this. You cannot send this back in. Okay. So they denied my claims for those reasons for 2 years. And ultimately, I got paid 0. So what must my response be? I can no longer care for Medicare patients because it cost me hundreds of dollars to pay my employees to bill this claim. Forget my time, my expertise, my services. It cost me money to send in a claim I was never going to get paid on. And the same often happens with Medicaid as well. These are the pressures that doctors are facing. A very good friend of mine is the recently outgoing president of the Utah Medical Association. And he informed me that he has physicians calling him weekly, telling him that they are resigning from the Medicare and Medicaid, Utah State Medicaid programs. Doctors are leaving these systems, and you're not hearing that on the news. I'm just telling you what's going on. I'm not trying to scare you. I'm just telling you what's real. Doctors are leaving these programs. They're not coming back, and they're certainly not going to be coming back when Congress institutes what they have described as a $500 billion cut to Medicare and a 20% cut in physician reimbursement. That's what they consider a successful example of healthcare delivered. President Obama recently compared his new healthcare plan with the post office. I don't know what you know about the post office. Maybe you used it. It's going bankrupt too. The deficits in the post office run in the billions of dollars. But he claims this is a successful example of how government can compete with private business and enterprise, UPS, FedEx. Didn't bother to say FedEx and UPS can't send first-class letters. They're prohibited by law from doing so. They have to pay taxes. They actually have to pay rent on their buildings. And they're prohibited from competing with the post office. And yet, this government program, the post office, is going out of business. That's what he compares to his new health plan. That's what he thinks he's going to do to run your health care. And that's the shining example. This is an administration and a government who frankly just doesn't get it. Obama set out 3 goals for healthcare reform: increased access, improved quality, and decreased cost. The current pending legislation will produce exactly the opposite. Physicians that I know personally are straining under their current obligations. Some are planning on changing their careers, while many discourage young people from even pursuing a career in medicine. One of my best friends from high school went through medical school with me and graduated, said that money didn't matter to him. He didn't care. He didn't go into medicine to make money. He wanted to be a pediatric psychiatrist, perhaps one of the lowest reimbursed of medical specialties. I discovered this year that he quit his career, for which he trained for over 10 years, at an expense of hundreds of thousands of dollars in medical school tuition. And he's now selling glass with his brother. He sells glass windows. Nothing wrong with being a glass window salesman. That's a great job. But the point is, he can make more money selling glass windows than he can make being a pediatric psychiatrist. This is the future of what's going to happen to physicians in our country. The best and the brightest will no longer be interested in a career in medicine. And when the best and the brightest are no longer available to you to make those critical life and death decisions, to protect you, to keep you alive, to cure your breast cancer, then people will suffer and people will die. Fewer and less qualified physicians means longer delays, more crowded waiting rooms, more chaotic emergency rooms, less appropriate care, and less optimal results. We already have a template for what government health care is going to be like. We have the Massachusetts example. It's only been around for a couple of years. Guy I'm a fan of, Mitt Romney, established that with the Democratic legislature there. They've recently said that the program is crumbling under its own weight. It achieved none of its goals. There are still Massachusetts citizens who are not covered, even though their goal is universal coverage. Cost expenditures went way over what was predicted, and they can't pay for it. And people are opting out of that system now because of long waits and what the patients describe as decreased quality of care. The president of the Canadian Medical Association reported just this week that their entire system is imploding. If Canada doesn't have the United States as a safety valve where they can come and get good health care for those who can afford it when they really need it, do we really think that any of them are still going to really even sort of like their system? We won't have anywhere else to go. We can't go to south of the border and get better health care in this country. Recently, Hawaii put together a Medicaid-like program to insure all of their children who are uninsured in the state. They budgeted several $1 million for this program. They found that many families who already had insurance for their children discovered that they could then go and insure their kids under the state program for free. Many, many people signed up, just like Cash for Clunkers. Why not? You're giving away free money. How could any program where you're giving away free money or free anything not be popular? It was extraordinarily popular. People by the drove signed up for it. It was way over budget, and the state of Hawaii realized they couldn't pay for it, and the governor just recently discontinued the program. I've been made aware just very recently of an anecdote. I don't know if it's true. It seems plausible to me. The state of Oregon has a rationed healthcare system. That was the whole point. They said that at the outset. We're going to ration care, and by rationing care, we're going to save some money. This woman came down with a terminal cancer. She attempted to get treatment, and the government sent her a letter and said, your treatment is going to be too expensive. We can't afford it, but we can offer you end-of-life options. Now, you know, people have excoriated Sarah Palin for saying Obama's death panels. And that's fine. You know, the health care bill doesn't ever say the death panel will be staffed by X, Y, and Z. But if any of you have had a chance to read anything in the health care bill, and I'm sure many of you have, that's what I've seen on TV. People at these meetings know more about the bills than these numbnuts that are writing it in Congress. It says plenty about innumerable bureaucracies, panels, individuals who will be appointed to oversee and make decisions regarding your health care, rationing your health care, deciding who will get what procedure, and whose life is worth keeping. That isn't the kind of health care that I want I know it's not the kind of health care that you want. As we know, when government control your life and your health, they can control every aspect of your life. Health care in the real world is a commodity. It is not a constitutional right. Despite what the UN may say, health care is not a right. There is nothing in the Constitution about the government's responsibility of providing you health care. And even if it did, it doesn't mean that the government can pay for it. The Constitution guarantees you a Second Amendment right to bear arms, but it doesn't give you a gun and it doesn't buy your bullets. You have a right to free speech, but the government doesn't have a responsibility to buy your television or your newspaper. When more people compete for a limited resource, the price of that resource inevitably goes up, not down. And when the government is in control, rather than ascribing to free market principles, corruption is magnified, waste is multiplied, and costs go out of control. Health insurance should be insurance on your health, not prepaid health care. An inexpensive, catastrophic care policy would be affordable to the vast majority of Americans, regardless of social status. And it would prevent the exhaustive and depleting, debilitating costs of a major unforeseen illness. But if the decisions for actually paying for health care were placed back into the hands of a discriminating consumer, rather than in insurance or in government bureaucracies, genuine competition would ensue, not the monopoly that the government has in mind. Quality and service would improve, costs would fall, and personal responsibility for one's own health would become preeminent. There are two branches of medicine that have seen cost declines over the last 10 years. Dentistry and plastic surgery. I have to compete on a daily basis. I have to provide the very best care that I'm capable of doing in the most comfortable environment. I have to take care of my patients. I have to make them love me. And I have to compete every day on cost with more competitors in this valley than there are anywhere else in the country. There are more plastic surgeons per capita here on the Wasatch Front than anywhere else. I have to compete. When I do that, I end up providing the best service that I can for the very lowest price. And my prices continue to come down. I'm trying to sneeze. Dentistry does that too. Okay? But you haven't seen that sort of competition or price decreases anywhere else in any other field of medicine. And that's because patients don't care what it costs ultimately, because the insurance is paying the bill. And insurance companies, as long as they're keeping patients happy and the doctors aren't rebelling, they're paying the money out. No one is really responsible. But I can guarantee you, making the government responsible is not going to cut our costs, it is not going to increase access, and it sure is not going to improve our quality. It never has, and it never will. We've got to decrease the costs of defensive medicine through tort reform by switching to a loser-pays system. I'm going to give you two more personal examples of why this is so important. And this is the stuff you're not going to hear on television, because nobody's talking about it. The Democrats, Republicans have done us badly too, and I'm not being partisan here, but the Democrats right now refuse to entertain any amendment that's put forward by Republicans in Congress to even talk about tort reform. And I know you all think that, well, you know, that's doctors just being whiny. Okay, that's fine, I understand that. But you have to understand how much that increases the costs. Every time you go to the doctor's office, or you get that bill from the hospital and you go, you've got to be kidding me. It really costs this much. Well, malpractice insurance premiums can run $250,000, $400,000 a year for a surgeon in different parts of this country. That's a huge expense that doctors, in order to stay in business, have to pass on to every single patient that they treat. Two quick personal examples. I was sued by a patient 2 years ago who came in for a tummy tuck procedure. She found out 6 months after the operation that she was pregnant. and discovered that she had been pregnant at the time of surgery. So I got this letter in the mail that said I was being sued. I thought, it's just unbelievable. I can't believe that. How could that happen? We do a pregnancy test on everybody before we do surgery. I went to the nurses at the surgery center who normally have the patient pee in the cup. And I said, do you remember this patient? What happened? She said, oh yeah, we remember her. She refused to take a pregnancy test. She said there was absolutely no possible way that she could be pregnant. Couldn't be possible. No reason for her to take the test. Well, turned out she was. She was 2 or 3 weeks pregnant at the time we did the surgery. Now, I did the operation. She looked great. She was very pleased with the result. Ultimately, she had her child, who was healthy, no mental, physical problems whatsoever. But she was suing me specifically for emotional distress that she experienced during her pregnancy because she was concerned about what possible effects it may have had on the baby. Well, we went through the things, the legal channels, and let me just say, I just found out this week, in fact, from a friend of hers who said that she had told her at the time that she had the operation because she was hoping it would terminate her pregnancy. She knew she was pregnant. She came in, had the operation done in the hopes that she would lose her baby. This is the kind of frivolous lawsuit that we have to deal with, and it's the kind of thing that each and every one of you are paying for. One more quick example. An obstetrician that I know, that I feel is one of the best obstetricians in the state, very busy, very prominent, works hard, has devoted his life to caring for women and their children, was called into the ER to take care of a woman who was in extremis. Her child was going to be delivered dead because they could tell from the oxygen levels that it wasn't doing well. She had attempted to have the child at home under the care of a midwife. The delivery didn't go well. She was rushed to the hospital, and when they called this obstetrician, he said, I'll be right there. Get her ready for an emergency cesarean section. 12 minutes after he received the phone call, he was in the OR and had this woman's child delivered. Healthy, mother survived, did great, baby did great. He was sued because of the emotional distress inflicted upon this woman's husband, who was worried about what was happening. True story. I know you're going to say, no, that can't happen. I'm telling you that's what happened. He was sued for emotional distress because he took her into the OR so quickly and saved her life and the life of her child. There are problems with the medical legal system that we have. And so when you hear doctors and anybody else who cares say, this is something that we need to address in order to save costs in our system. And when the Democrats turn a deaf ear to those requests, you know there's something wrong. Is it because they're in the pocket of the trial lawyers? Maybe. Is it because most of them are lawyers? Maybe. But those are some of the problems that we've got to really fix. The problem is not that there are uninsured people in our country. There are, and that can be tragic. But the 47 million people that they claim are uninsured is a lie. You need to know that. About 1/3 of that 47 million people are illegal aliens. Now, we can have a debate on whether or not you all have a responsibility to provide them with free care. That's fine, we can have that discussion. I personally don't believe that those people should be getting care in our system that's paid for by people paying taxes. Another 1/3 are children who would qualify already under Medicaid as CHIP, but their parents are either too lazy or too ignorant or too uninformed to sign them up. It's not that they don't have care or would qualify for care. They already qualify. They just have to sign up. About another 1/3 of that group are young people, 25 to 35. They're healthy, vibrant. They don't think they need it. I have a nurse who works for me who is angry about this whole healthcare thing because she says, I don't want health insurance. It's expensive. I don't need it. I'm not going to be sick in the next 5 years. I will be angry if they make me buy it. We can argue whether those people should have forced coverage. But that's part of the group of people that they're including in the uninsured, people that don't want health insurance. Now, apart from that, there is a group, a cohort that has chronic illnesses, pre-existing conditions. They don't have a job, they're not getting insurance through their employer. They can't afford the care that they need. The total cost estimated to cover that group of people per year is under $50 billion. It's a lot of money, I know, but it's not 1.6 trillion. And that's a big difference. Our government could cover the people that need to be covered, or a tiny sliver, as Obama is fond of saying, for much less of what they're planning on spending. And I know I'm probably taking more time than I'm supposed to, but I haven't read the bill, the whole bill myself, but I'm going to go over just a couple things that are in it, just so you know. And some of these things you may have heard on TV, some of them you probably haven't. I just want to let you know, though, that there are pundits on Fox News and otherwhere who have talked a lot about how dangerous this bill is and what it's going to do. And I can tell you that it's not as bad as they are making it out to be. It's much, much worse. I'll just read a couple. On page 22, it mandates that the government will audit the books of all employers that provide insurance to their employees. Section 123 actually is a section that provides for rationing of health care. Page 50, section 152, health care will be provided to all non-U.S. citizens, illegal or otherwise. Page 58, the government will have real-time access to every individual's finances and your bank account. And they will be able to automatic debit you for your health premiums or the cost of your care. Section 164 is designed as a payoff for a subsidized plan for retirees and their families if they belong to a union or a community organizing group. Page 127, the government is going to prescribe salaries for all physicians and healthcare providers. Page 145, an employer must auto-enroll employees into the public plan option. Employers must pay for health care for all part-time employees and their families. There will be a tax varying from 2 to 8% on payroll for an employee that doesn't have coverage. Any non-resident alien is exempt from individual taxes for their health care. The government will reduce physician services for Medicaid. Seniors, low-income individuals, and the poor will be predominantly affected. Page 341. The government has the authority to disqualify Medicare Advantage plans, Part B, HMOs, which will force people into the government plan. Page 354. The government will have the option of restricting enrollment of special needs patients. There's a whole section on the death panels where they give end-of-life counseling. Page 503. The government will build registries and data networks from your medical record. Every urinary tract infection, that case of gonorrhea you had back in the 70s, every other medical problem that you have will be part of the national database. Page 503 allows the government to secure data directly from any department or agency of the U.S. who has any of your data. Page 504. This center will collect data, both published and unpublished, I don't even know what that means, on your health care. And page 506, the center will recommend policies that would allow for public access of this data. This is in the bill. I'm not making this up. This is in the bill that they don't want you to read, and that they don't want to even claim that they've read either. Now, again, whatever your political persuasion, you need to understand the economics of health care and where we're headed with this bill. This is not the America that I ever believed that I was born into. It's not the America that I believe in. We have discussed some of the ways that we can curb healthcare costs. Health insurance needs to be portable across state lines. It has to be available for purchase to everyone, regardless of pre-existing conditions and employment classification. But these are a few of the ways that I've outlined that we can preserve quality of care in our country without government rationing and control, while holding to the principles of freedom and liberty, which I believe we all hold dear. Again, I thank you for being here, and I've taken up a lot of your time, but I know we wanted to have some question and answers, and Susan,